If you have questions, please raise your hand and a page will bring you a card. Okay, the next question will start with Mr. Germain. Local research shows transportation is an issue and a challenge for our youth to get to programs and activities because of the lack of public transportation, distance between communities, and the cost of gas. What can be done to improve this situation?
It's a difficult situation in every community in the UP. I used to work with Friends of Data, which in our area is the Delta Area Transit Authority. And it was a question that we really talked about as well, because we had this bus system that couldn't fully run on a full day schedule because of funding issues. They were only charging $2 a ride. You get some federal match grants on how much you raise and how much you're doing. So they started doing different things like advertising and stuff like that on the buses, but that only helped a little bit. So they had to go back and ask the community for a millage. And it's hard to go and ask for somebody to pay a little bit more, but when we looked at it across the board, we got different communities on board with it. When they found out it was only going to cost them about $10 a year, we were really able to help out the youth in the community. We were able to help out our senior citizens and handicapped people to help them get around with this bus service. It's really hard in a rural community to get that accomplished.
I think it goes to Scott, right?
Sorry.
That's okay.
I'm stuck in
Could
you just run the question one more time?
Sure. Local research shows transportation is an issue and a challenge for our youth to get to programs and activities. Because of this lack of public transportation, the distance between communities, and the cost of gas, what can be done to improve this situation?
Well, I think to be able to improve that situation is going to take a lot of effort on our part as the elected officials to take a look at the Department of Transportation's budget, number one issue. I think that we spend a lot of resources in other areas that money could be put for public transportation. And it's not just the youth trying to be able to have a job to be able to get to. It's our people who are challenged as far as being able to go on their own without having any type of transportation. It's our aging senior communities that can't afford to have a vehicle anymore, can't afford the gas, and they just have a big financial burden to try to be able to survive on what they're making now. So I think there are ways of us to raise money to put it in public transportation. And I think that just, one of the things that I brought up was a piece of legislation for MDOT to sell their airplanes, because we're spending about $8 million a year on air service for one department. I think that that is something that would be well spent on public transportation.
Local research shows transportation is an issue and a challenge for our youth to get to programs and activities. Because of the lack of public transportation, the distance between communities, and the cost of gas, what can be done to improve this situation?
Yeah, the transportation issue is all the above, and I think, number one, convincing enough people that we have a funding problem with transportation, because when you look at Act 51, public transportation is part of that. And so what we're finding is we're not putting enough money down through Act 51, so when it gets distributed to build our highways and our infrastructure for public transportation, all the above, we're not putting enough money through anymore. It's been, 1996 was the last time there was any increase. It's at 19 cents a gallon. Wisconsin, as an example, is 31. We're at 19. We have a funding problem that needs to be addressed. When you look at public transportation, though, I would also challenge the public transportation system to adapt to the communities that we're in. In other words, all communities cannot have something like, let's say, Detroit or Grand Rapids. That's a different animal. It's a different thing to try and deal with that. But where we can provide the public service for public transportation, the equipment and the things that they're using should be more adapted to the community.
Okay, the next question will start with Mr. Dianda. Many services that children and adolescents receive from Copper Country Mental Health are provided with non-Medicaid or general fund revenue. The general fund revenue to Copper Country Mental Health has been reduced by $1.2 million over the last year. What provisions are being made so that we can continue to provide necessary mental health services to children and families who do not have Medicaid, Healthy Michigan, or My Child?
I think what's being happened is it's just a constant discussion that we have as the elected officials. We've cut $83 million out of the mental health budget across Michigan. It's absolutely terrible what has happened. Copper Country Mental Health has had to make a change on how they're looking at patients. You know, if they're looking at 100 people, they're prioritizing them 1 to 100 who's going to be taken care of for service. I think that it's a responsibility as us as the elected officials, as you as the electoral body out there, to make sure that you're contacting the governor's office to make sure that it's a priority. The only way we're going to get the money back into that situation is by encouraging the governor's office to be able to make sure that they understand the director of the Department of Human Services, that they have that money in there for the community health. And we got to take care of that. So I encourage everybody to have that discussion.
Again, I spoke on mental health services before. It's a vital piece that we need, and we need the funding there for it. I spoke with a gentleman after I had spoke on this issue in Marquette, and he said there's a lot of issues that are blocking the mental health services, and he said some of those are legislative. I was speaking with a gentleman in Dickinson who his daughter had bulimia. He went to the local equivalent of Pathways in Dickinson, and they had no information there for him. They weren't able to help. And the gentleman in Marquette told me afterwards it's because of a legislative issue, that if legislatively Michigan blocks what you can offer as far as mental services. Part of that might have been because of the funding cuts. I'm not sure because I wasn't sitting at the table when that decision was made. But the fact of the matter remains that we need these services in our community readily available and free to the public.
Mr. Casperson? Do you want me to reread the question?
Yeah, could you?
Sure. Many services that children and adolescents receive from Copper Country Mental Health Services are provided with non-Medicaid or general fund revenue. The general fund revenue to Copper Country Mental Health has been reduced by $1.2 million over the last year. What provisions are being made so that we can continue to provide necessary mental health services to children and families who do not have Medicaid, Healthy Michigan, or My Child?
Yeah, it's twofold, I think. We mentioned it earlier, we were talking about the prisons and the mental health problem there. There is discussion now, and I think we're moving in the right direction, and that is, years ago, they took the hospitals and they closed them down. And what I believe happened was a lot of people that had mental illness then ending up in our prison system. So we're spending an awful lot of money incarcerating people that don't need to be maybe incarcerated as much as they need some mental help. So we're leaning back towards the hospital method, which I would prefer. On the child side of it, what I've noticed is I've been talking with folks within the Great Start program and different programs that are out there for our children, and there are social workers within those programs that have been hired. The problem that I see there is that the social workers and the money that goes for those social workers, I think, should be directed towards our schools, because that's where they're going to see the problem and that's where they'll pick up on it. Because when I asked about it, they said the only way they can find out is a referral. I prefer to put it in the school.
Okay. We'll start the next question with Mr. Casperson. Can you give us your thoughts on Governor Snyder's recent proposal to increase the state minimum wage over a period of time?
Yeah, the minimum wage came up when I was in the House. It continues to come up, usually comes up around a campaign season, and it's used in a way that can get you politically. So this last go around, there was a ballot initiative that was proposed to raise the minimum wage, and it was a pretty significant increase. And we believe that the polling indicated it would probably go. So we thought the problem with it was the extreme increase was going to have a profound effect on our economy. Now, those would argue that, well, you're putting more money in people's hands, but at the same time, the small business person that has somebody working for them answering a phone or doing something like that, they're going to look at technologies and they're going to say, is it more cost effective to have a machine answer the phone or me answer the phone, as an example. And we've seen that happen. That's a problem. So what we tried to do was put something in with a sliding scale, take this political issue off the equation, put it in place, and hopefully everybody can agree we'll be done with it and let it take its course.
I believe that the compromise that was passed was a good compromise between the two parties. Like Tom had mentioned, there was a 10-10 ballot initiative, but what we wound up with was a gradual scale, an immediate increase to help take some of the burden off of the people that are using it to make a living, and then a gradual increase from there on out. I come from a business background as well as a working family, so I kind of have a unique perspective on both. At the Upper Peninsula Association of Realtors, we employ people, and we employ them above minimum wage, but we're able to do that. Not all mom and pop businesses are able to do that. So if we would have had such a dramatic increase immediately, that would have had an effect. So I do agree with the compromise, and that it was a gradual increase at the time. But it goes back to the fact that the unfortunate reality is we have people living on minimum wage that are trying to raise a family. We need to get better jobs here in the Upper Peninsula, and we need to become more attractive to business up here. And we need to provide the resources available to industry to be able to build here.
With the minimum wage in Michigan, it should be $40,000 to $50,000 a year should be our Michigan minimum wage. And I hope that we get to the point that we build up a better state and that we get away from talking about a low amount of dollars that we're paying people. I also was for the compromise to be able to get it immediately out there because we knew that it probably would not have the legs to pass and we would not be able to get that done. But it was nice to see that it did come through. But I definitely say that, you know, being a small business owner in the past, I've always paid people way above, beyond minimum wage, because you always get what you pay for and you profit together. And when I paid people to work in my retail shop, I had better employees, they had better sales, everything was a better situation with paying people a better wage.
Okay, the next question will start with Mr. Germain. The Workforce Innovation and Opportunities Act bill was passed in the Senate and the House. On July 22nd, President Obama signed the bill, which included improvements to the Rehabilitation Act of 1973. The new legislation emphasizes transition services for special ed students and will have a significant impact on the future of transition services across the nation and in Michigan. What could Michigan implement to impact the success of transition students in our schools?
We were talking about this issue a little bit earlier today because we were talking so much about the standardized testing and some of the initiatives that have come down from the federal level. What we have is a problem at the special ed level where they're not able to customize those programs. We need to assure in Michigan that we're allowed to kind of give a little local control back to the school boards, to the school administrators and teachers to be able to work these programs and be able to work with special education students to provide them with opportunities. And again, private industry does play a nice role in this too. In our area, we have Lake State Industries, which does job training for people who have barriers to employment. And I think we need to help those kind of businesses out. And of course, they do utilize the state for some of their operations there. But to answer it in a minute is kind of hard, so I'm trying to hit all the key components of it. But we really need to be able to customize those programs to be able to foster education for special education students.
I think one thing that would be very successful for us in Michigan to be able to help special education is to be able to partner them up with vocational training. We can do specific vocational training for people with special needs to be able to train them in something that they could work on throughout their life as far as getting them into positions. And working with private industry to have those folks available for them. I mean, I think there's a lot of jobs out there that we are looking for a lot of people to be able to do. So thank you.
Thank you. I think the question was, what can we do in the state to improve some of this collaboration? Correct?
Yes.
I'm convinced, and you mentioned the Washington stuff, it's great if they're going to step in and help, but I would caution us what kind of strings are coming with that help. And I would say the same thing on the state level. We from the state level can come up with ideas and funding mechanisms to try and help, but be cautious what are the strings that come with it. What we can do as a state, in my opinion, the best thing we can do is try to limit any strings coming from our end of it as much as possible and encourage local teachers, local school boards to work collaboratively to come up with solutions for these problems that you just mentioned. I am convinced the people on the ground will have the answers and the solutions, but unfortunately too many times we set up programs, send funding with it, but we have to attach strings to it, and then you have to run a program like one size fits all. I would like to see us get away from that and let the locals have more say. If they need the money, let's try to get them the money.